our fall training series. My name is Andrea Polk. I'm the Children's System of Care Administrator here at Aetna Better Health of Kentucky. Thank you all for being here today, and hopefully some of you guys were able to attend our 3 previous trainings this fall. I want to just do some housekeeping tips. Please make sure you remain on mute. If you do have questions, please put them in the chat and I will address them as the training goes on, or if they're specific to the training, and if we have time, we will have our presenters address those. I did put the resource folder in the chat. Those are all the materials that you all will need in regards to today's presentation. I will also be putting the link to the evaluation towards the end of the training. You will need to complete that to get CEU credit or a certificate of completion, which will be mailed out by KATC, or emailed out, I should say, by early next week. And please try to have those evaluations done by Friday, if possible. And this is also being recorded and uploaded to the KATC YouTube channel in case you have coworkers that weren't able to attend today and would like to view the training. So with that being said, I think we're ready to go, and I would like to introduce our presenters today, Tracy Belfield and Mike Miller with the Kentucky Autism Training Center.
Mike, I'll let you go first.
Thank you. I'm Mike Miller, and I'm Family Field Training Coordinator at the Kentucky Autism Training Center. I work with families in navigating resources and providing services to get them anything from preschool to the diagnosis to the school functionings. And so you'll find out more about that. My contact information will be at the end of the presentation, and hope you enjoy today.
Hello, I'm Tracy Belfield. I'm a field training coordinator also with Kentucky Autism Training Center. I am what we call a school FTC. So I primarily work with schools, but I also work out in the community with first responders and other agencies like that. So again, I just left the school system about a year ago. So this was kind of an easy topic to take on, and I'm excited to present this and help you guys have a better working relationship with your school systems. So again, I'm really excited about this topic because we know that working together is such a needed thing for our students. It really takes everybody working together and being on the same page. But due to all the laws and regulations that are in place, it can be a very complicated system. And so our overarching goal today for Mike and I is really to kind of familiar you all with the systems and the processes, kind of get you familiar with some of the language and stuff. So our objectives are, we will work on how to make a child find a referral so that you know that process. We'll talk about the difference in a medical determination and educational eligibility. And then we want you to be familiar with the major components of an individual education program, also known as an IEP, and then to help familiarize yourself with some of the evidence-based practices and interventions, which if you've been watching some of our other webinars, you're already familiar with some of those. So you've got a head start with that. So kind of before we get started, we got to uncover some of the secret language that is often used in special education, the world of acronyms. There are some listed on this page. This is by no means a full encompassing dictionary or glossary. In your resource guide, we've actually put 2 different resources that have those in there. So just kind of please know that, and know that when you're in conversation with professionals and they start using these acronyms, they're not doing it to throw you off. It just really is kind of second nature to us that live in that world, and it's just the language we speak. So please stop them and say, hey, what does that mean if you're not familiar with that? And encourage your parents to do the same thing. There is nothing wrong with that. So we will go through some of these kind of high frequency acronyms that we have. So the first one, of course, is an ARC, which is the Admission and Release Committee. The ARC really is the team of individuals that makes the educational decisions for the child. who may need special education services. So this includes the parent, the child as appropriate. Usually that starts around age 14, but sometimes they're involved even earlier. A regular education teacher should be on the team. Of course, a special education teacher should be there, and then some type of district representative. And that could be anyone from a principal, the director of special education, guidance counselor, or anyone else that they deem appropriate. If any evaluations were done, the evaluator should be there to kind of explain their process and their findings. And then if the child is either looking at or currently receiving any related services, those providers should be there also. Sometimes you'll hear the ARC or ARC team also referred to as the IEP team. That's typically the same thing that they're referring to. Those words are just kind of used interchangeably. The next one listed on there is the Behavior Intervention Plan, sometimes called a BIP or a BIP. I personally like BIP better and is usually what I used in my language. It is a plan that is still part of the IEP, but it is a separate document. So it's still a legal part of that. It's usually put in place when there's some behaviors that are impacting the student's learning or that of others that the IEP has not been adequately able to address. So it'll target kind of those target behaviors and will address what they're doing to kind of work on changing those behaviors through positive behavior interventions and the strategies that need to be taught. So it just keeps everybody kind of on the same plan so that everybody knows that language. Next is the Functional Behavioral Assessment, or FBA. Usually that is done before a BIP is created, but sometimes teams go ahead and kind of get an emergency behavior intervention plan in place while they're working on the FBA. And the FBA is just a process of collecting information concerning that behavior. They take the information collected and they try to determine what the function of the behavior is or why the student is doing what they're doing, because you kind of need to understand that to determine the correct replacement behaviors to be most effective. And so once that target behavior has been identified, the function has been identified, then you'll go into writing the behavior intervention plan that FBA will kind of help drive. The individual education plan, of course, is kind of the foundation of a lot of special education services. It is a written education plan. It is for children 3 to 21. So you do not have to wait until they are 5 years old. If you think that there is a concern, we can start as early as 3 years old. The plan is still developed by that team of professionals that we talked about earlier, the ARC. It is a legally binding document that the team writes to meet the student's unique needs that are identified with the disability. So basically, it just helps guarantee that services specified in that plan are kind of followed through and whatnot, and that, again, everybody's on the same page with that. And then the last term that I'm going to address on this slide is the least restrictive environment, or LRE. And that is the educational setting that provides the student access to the general education curriculum, along with their same age peers to the greatest extent possible based on that child's individual needs. Again, that decision is re-examined annually, so it's not kind of a written in stone once one placement decision is made that it stays that way. It's determined annually. Again, we've added a lot of resources in the resource folder. So specifically for acronyms, you can look at the Kentucky Parent Guide of Special Education around page 26. It starts addressing these acronyms. And then we've also included the Kentucky SPIN Special Education Glossary of terms to go into those. On the other side of that slide, of course, OTPT, speech therapist, those are just kind of all the therapists, but those are the acronyms that you'll hear associated with those. So the first kind of step that may happen with special education is really identifying the child, and we call that child find. So either you, the parent, guardian, really anyone who suspects the child has a disability and they're not receiving special education services, and again, they kind of fall between that age range of 3 to 21, you can make a referral. So in order for them to receive special education services, they'll have to be evaluated to see if they actually have an identified disability and if there's a need for specially designed instruction. That's kind of the real crux of everything. Like there has to be a reason that they need specially designed instruction. We'll talk in a little bit. Sometimes a student has a disability, but it's not necessarily impacting them educationally, and therefore specially designed instruction is not needed. And so they may not need special education services. So just because a student has a disability doesn't automatically mean that they require special education services. So specially designed instruction is also referred to as SDI, just to throw another acronym out there. And basically, that means that the general education content materials might need to be modified. The methods of teaching might need to be a little bit accommodations provided, things like that. So again, things are done to help meet that student's unique needs in them. So if there is a student who you feel might require those services, again, you can make a referral. You just kind of let the school know. And once they know, they'll kind of start looking at the next steps with that. It is best to do it in writing just so that you have documentation of that request, but you can make a referral simply through, calling, text messaging if you've got a teacher that you communicate that way, or going in person. But again, written request is really the best way just because it kind of provides documentation for everybody. So again, anybody suspecting that disability can make that referral. So again, it can be those classroom teachers, parents, mental health providers, other community members. It could be the neighbor next door if they suspect that there's a disability and the child's not receiving services. The neighbor can make the referral. So once that referral has been made, the school staff will invite the parent or guardian to a meeting to discuss the referral and then kind of decide those next steps within that process. So here is where I was kind of hinting to a little bit the difference between a medical diagnosis and educational special education eligibility, and kind of looking at the difference of those. So a medical diagnosis is made by a medical professional. For the area of autism, they're going to look at the DSM-5, which is the current kind of standard. So students are going to have to meet specified criteria to be diagnosed. For students for special education eligibility, of course, that's going to be decided by that school ARC team. They're going to look and see if the students meet the qualifications as outlined in the Individual with Disabilities Education Act, or IDA, as well as the Kentucky Administration regulations, which are the KARs. There's got to be evidence that the condition is negatively impacting the student's learning or educational performance. And these decisions are made again by that multidisciplinary team or that ARC member, because of course, or team, because that ARC team's got a lot of different backgrounds on there. So that's why it's also called a multidisciplinary team. So again, you can see where sometimes a student with a medical diagnosis of autism may not necessarily qualify for special education services, because depending on how the autism is really affecting them, it may or may not need specially designed instruction. So if for some reason they do not qualify for special education services, please know there are other services that they may in fact qualify for. So let's take a little bit closer look at the DSM and medical diagnosis. So of course, for a DSM diagnosis, you kind of have to go through these steps that'll be on the next 3 slides here. The person's got to have deficits in their social communication and social interaction, and it's got to fall in all 3 of these categories. So that social emotional reciprocity, that's that individual's ability to engage in those social interactions between 2 or more people. So that's going to be an area that's going to be required by the DSM. Deficits in that nonverbal communication, a lot of time that's going to be relevant to the eye contact. It may be absent altogether. It may be reduced eye contact, or it may even be just atypical type of eye contact where maybe they glance at you and they glance away. But but you also have to take into consideration cultural norms, because for some of our populations, culturally, it's just not appropriate to make direct eye contact like we do typically here in America. But some other nonverbal communication behaviors can include gestures, facial expressions, just that body orientation. So there's lots of things that you can look at in that nonverbal communicative area. And then also looking at deficits in developing and maintaining and understanding relationships. So a student may have difficulty adjusting their behaviors to different social contexts. Again, my behavior at work looks a little bit different than it may in my home setting where I'm a little bit more casual and relaxed. And so students that are diagnosed with autism may have difficulty kind of making those social contacts. They have difficulty in sharing an imaginative play. Of course, we see that in our younger students, difficulty making friends, and just being absent of the interest of that their peers might be interested in. So there's a lot that goes into this first piece of the criteria. The next part is those restrictive, repetitive patterns of behavior, interest, or activities. So a student would need to have at least 2 of these items. So kind of those stereotyped and repetitive behavior motions are kind of those stemming behaviors that we think of. So it could be the flapping and waving of arms, hand flapping, head nodding, the rocking back and forth. Insistence on sameness and inflexibility. These are our kids that are super rigid and they need that constant routine. Everything has to go exactly the same every day, or we potentially have a meltdown situation. They're also very ritualistic in their patterns. Again, the order that things are done in, even when they play with their toys, this is in the young ones where we see them kind of lining up, but they not only line them up, but they may line them up in a specific order. So I have seen, like with Thomas the Tank, that students will line them up in the order that they were actually introduced to the TV series, because they're that rigid in their thinking. Next one there is kind of being highly restricted and fixated on interest. And again, this can be a wide variety of things, but some of the ones that I have seen is students watching a fan spin around, and they could do this for hours if they were left there to do it. They just really get fixated on that. A student taking a flag on a toy mailbox and just, again, making it go up and down, and can sit there and do that repetitively. Carrying some type of animate object around everywhere, kind of obsessively. Again, I know young children tend to do that, but you'll see a difference. It'll be a little bit more ritualistic in the way that they do it, and that they're really hyper attached to that item. And then the last thing listed on this page is the sensory input. And so our kids can be hyper or hypo reactive to sensory input. And so again, think about all of your sensory input, whether it be vision, hearing, touch, taste, food textures, all of that. Again, some of our kids aren't able to verbally explain what's going on in their body when they're getting overstimulated or even understimulated. But if you watch them, I think understimulated sometimes can be harder to see in a student, but in our younger children, we can see them kind of like crashing into walls and stuff, maybe on their ride-in toys, trying to get that sensory input. Because I've had older students explain it's almost like their body is floating in space and that they don't feel grounded and connected. And so they kind of need that deep pressure. And those are kids, again, when you see them in line, they might be bumping into their neighbors. And it's not that they're trying to be funny or disruptive to class, but they're really seeking that sensory input to try to get their body a little bit more connected. And then on the last slide for the DSM, these symptoms just need to be present in early development. It doesn't mean they necessarily have to be identified early in development, but kind of looking back in hindsight, you would have kind of noticed it, even though you didn't see it at the time, as far as acknowledging that there might have been something a little bit different. And the systems cause clinically significant impairment in the social, occupational, and other important areas of current functioning. And then, of course, if none of these disturbances are better explained by some type of intellectual disability or some type of global developmental disability, we don't want to have a better explanation for what might be going on. So with the DSM-5, they also kind of change the way that they label. There used to be subcategories of Asperger's, pervasive developmental disorder not otherwise specified, but now kind of all those labels under the DSM-5 are not there anymore, and it's just one umbrella of quote unquote autism, but they do have levels. And so level 1 is just the student requires, some supports. Level 2 is requiring substantial supports. And then level 3, of course, is very substantial supports. So that is how the DSM-5 looks at it. So then when we look at a school setting, like I said, I'm looking at eligibility. They really have to look at that IDA and KARs. So here we're going to dig a little deeper into the KARs. We know that when they're looking through it and they do all of their testing and the team comes back together to decide if the student is eligible under that category of autism, these are the things that they're going to kind of look through and discuss. And so they're going to look and see, does the student have some type of developmental disability that's affecting their verbal and nonverbal communication? Typically speaking, a speech pathologist is going to have done some type of assessments that's going to feed into giving that data and giving information for the team to talk about. Does the student have a developmental disability affecting social interaction? Again, this may be noted by the speech pathologist, but may also be noted by the school psychologist that did other testing. The deficits are not primarily the result of an emotional behavior disability. So again, you can see here, they're trying to rule out other things. And as was mentioned earlier, they're really going to be looking for that adverse impact on the educational performance. The last 2 bullets on there, again, they just want to make sure that we are not missing anything when we look at this, and it wasn't due to a lack of instruction in reading and math. Again, with COVID, that's been kind of a big thing because kids miss gaps in their learning. And so you have to figure out, is what's going on true deficits, or was it possibly because of a lack of instruction in reading and math, and kind of working through that. So that can be complicated for the team. And then the same thing kind of with limited English proficiency, making sure that that's not the case. That is not to say that a student who is limited English proficiency would not qualify under the category of autism, but kind of tweezing all of that apart and making sure that we're not categorizing kind of communication deficits because English is not their primary language. So again, those are just some complicated things that the whole ARC team has to talk about and kind of move through. So as you can see, it can become very confusing, especially for parents and caregivers, to not necessarily understand. They'll be like, oh, but my student or my child has a diagnosis of autism from their doctor. Why do they not qualify for special education services when the team meets and goes through all of this? And typically it's because it's not having an educational impact. But like I said, there are other services, and Mike will share some of that with us when he shares. And then sometimes we see the reverse of a student hasn't had a medical diagnosis yet, but due to referrals and going through the eligibility area that best fits that student in a school setting is autism. And so sometimes parents are a little taken back, and we have to just remind them that that's an eligibility determination, not a medical diagnosis, that's still up to the doctor to do. So again, in your resource folder, we went ahead and added the KDE Autism Eligibility Determination Form. So you can see exactly what the team looks at, and that's public information on the KDE website. But we added a copy of it there for you as well. Related services of occupational and physical therapy and speech services. Again, there's a difference between a medical model and school model. And I've personally had to have many conversations with parents because they don't understand why maybe the school model is not giving more minutes or more service time. And so I kind of have to explain this to them, that the models are very different. Under a medical model, it really is about enhancing their functioning at home and out in the community. It's addressing medical needs that the doctor has put in. With the school model, again, it's really focused on how is it affecting them in that school setting? How is it affecting their academics, their access to school activities, be it after school activities, clubs and sports and things like that. And it's really about supporting the IEP goal. And those providers, kind of as the title of the slide says, are related service providers. So really the special education teacher is still the primary person providing those supports and services. So again, I still worked on speech and language things with my students and consulted with my speech and language therapist at the school. She would provide her time, but I was still reinforcing and working on those goals throughout the time that I had my students as well. And so the other teachers are doing that within their daily thing too. Again, we put a little infographic in the resource folder so that you would have that and you can share that with parents if you need to explain or kind of talk through that with them. So we've kind of done child find. We've kind of talked a little bit about what that process then looks like after they've decided to do testing and all the things that they have to consider. So if a student is determined eligible for services, an IEP or education program will be developed. Like I said, if they do not qualify, there are other services that they can look at. And so we'll talk about those here in a little bit. So let's just talk a little bit about the components of the IEP, because again, that's a very lengthy document. I'm going to tell you again, as a classroom teacher, writing one of these was another full day. It usually took me about 6 hours from beginning to end for many of my students to really get in and analyze all of their data. So the draft that I would put together already had a lot in there, but it is still an ARC decision, and all voices and opinions need to be shared at the table. And so we'll talk about those components. So the first part, and really the foundation of the IEP, and I think of it just like building a house. You got to have a good, solid, strong foundation, is what is shortly called present levels, but the full name is present levels of academic achievement and functional performance. This area really should highlight the students' relative strengths, where they're performing compared to their same age peers, what needs and concerns that the team is seeing, and then those needs and concerns really should have some baseline data to go with it. So again, something to measure how the student is doing, because we need to know where they're starting at that baseline to be able to develop goals and know what's appropriate for them. And then how that disability is adversely affecting the student's involvement and progress in the general education curriculum. So for students with autism, at minimum, the areas of communication and social emotional are going to be addressed in the present levels, because those are the two big areas of eligibility. Sometimes they'll have academic goals, but again, not every student with autism has academic deficits, so they may not need goals in that area. The next part of the IEP is consideration of special factors. IDA requires ARC members consider 6 different areas of special factors. And again, we just want to keep these things in mind as we're developing the IEP, because they are kind of crucial pieces that we've got to remember. So the first area is behavior. Next is limited English proficiency, any visual impairments, any communication needs, if the student is hard of hearing, and if the student needs assistive technology. So again, typically these things would have already been mentioned in the present levels, but you're going to readdress them in this consideration of special factors. So we've got the foundation laid. So now we're really ready to develop some annual goals. The annual goals, measurable annual goals here, are the goals that are going to be based on the needs and area of concern that were identified in the present level of the student. They do have to be, again, measurable, which is why that baseline is so critical. And the team is going to have to believe that the student can reasonably accomplish that goal within 1 calendar year, so 365 days. is really what the goal should be. After we've kind of determined what that goal is, we've got to determine what is the specially designed instruction going to do. Basically, what is the teacher going to do to instruct, assess, and reteach the student? How is she or he, going to adapt the content, the methodology, or the delivery of the instruction to address the student's unique needs based on their disability to give them access to that general curriculum? And then we get into supplementary aids and services, which is really what does the student need in order to learn? So these are tools and things that we're going to kind of put more in the student's control. So these could be strategies, aids, other services, other supports that they need, again, to access that general education environment, or again, other educational settings to gain access. So if there's after school, again, if they're on the basketball team, if there's something that they need in supplementary aids and services to be able to do that, it also needs to be outlined in there. Accommodations. So those are the things that allows the student to demonstrate what they have learned on those classroom, state, and district assessments. Accommodations do need to be related to the student's disability. You still have to have data from the evaluations to help support them. And they've got to be routinely used in the classroom. If they are not being used in the classroom, you can't just magically on test day, oh, it's K-prep time, although I think they changed the name of it last year, but give the accommodation, like they have to be using that and practicing it in the classroom in their regular instruction. Least restrictive environment and placement decisions. Again, this is where the team's going to talk about and decide to the maximum extent that the student can be educated with their non-disabled peers. So again, really looking at special classes, separate schools, or removal from that general education environment should only occur if education in that general education environment with the use of those supplementary aids and services and specially designed instruction cannot be satisfactorily achieved due to the nature and severity of the student's disability, because we really want them with their non-disabled peers to the maximum amount possible. Related services, we kind of mentioned earlier, those are those services needed for the student to kind of benefit from the special education services in the gen ed settings. They're outlined in the IEP. They also, on top of like occupational therapy, physical therapy, and speech, which are probably the three most common possible related services, includes transportation. So some students need special transportation. So that would be put in there. So just know that that's also a related service. Extended school year are those services that are designed not to teach new skills or to help make the student make additional progress on those annual goals, but it's really about maintaining their present levels of performance. So teachers should be keeping data, particularly those breaks in schools. So like fall break, Christmas break, spring break. And if they're seeing a dip and the student not recovering in a reasonable amount of time, then the team might need to talk about some extended school year services, particularly over summer, to make sure that we're not losing skills and spending too much time recovering those. And then the last thing on this slide is secondary transition. So transition needs need to start being discussed either in 8th grade or age 14, whichever happens first for the student. Again, when transition is discussed, the student should be invited to that meeting because we're talking about their future and what's going to happen post-graduation. So it really needs to be focused on them because that process needs to be student-centered, student-driven, and embedded throughout the whole IEP. Transition services should be coordinated set of activities that are set up annually. So again, every year we're looking at what do we need to do to help the student achieve their goal. And help prepare that student for kind of life after school. So that is a lot of information about IEPs. Like I said, you see why it's so complicated and overwhelming for those that don't live it and breathe it every single day, why it's intimidating for parents. I would remind parents they are allowed to bring somebody to an ARC meeting if they need or want to, and that can be another professional that services their child, or it can just be their support person, so to speak, to help them. Also, Kentucky Spin is an amazing resource for helping parents understand IEPs. And we've got that in our helpful website link. So please know that Kentucky Spin is a great resource. At this time, I'm going to hand it over to my colleague, Mike Miller, to finish up our presentation.
Thank you, Tracy. I want to talk about that. Tracy was talking about if they didn't qualify for the individual education program. This is an alternative that they may be eligible for, is a 504 plan. And this is talking about accommodations. And when we talk about an accommodation, it may be extended test time for quizzes, tests, earplugs or noise canceling headsets in the hallways, lunchroom. They may need a break time during the day, and so that can be addressed in your 504 plan. Clearly established and ordered routines. Sometimes a visual schedule is something that's very beneficial in providing that. And one of the things that as a student gets older, I really encourage teachers to sit down with the student and discuss that 504 plan. So not only does the student understand, also the teacher understands a little bit more about what is expected with that 504 plan. And the 504 plan addresses the unique learning needs of the student with a disability and provides the reasonable accommodations. Next, Tracy. If you found eligible for a 504 plan, a service plan will be developed. And with this service plan, after looking at evaluation data, the group will review the information, the data used in the evaluation and eligibility determination process. Decide what accommodations and modifications are needed to meet the unique needs of the student and allow student with a disability to fully participate in the general education program. Also, one of the things is after a student exits a school after grade 12 or age 21, then your individual education program is no longer functional. So then you would have the 504 plan. And so you would need a 504 plan to maybe go through with older students, and that's probably to go into detail with that is another training, but it's like the 504 plan, after the group looks at the evaluation, determines the process, the impact of the identified disability, the necessary accommodations to access education and other school activities, and when, how, and why the accommodation will be provided. For example, there may be a student that needs a meeting with the teacher before school starts to go over what is required today, what's on my list today, and or at the end of the day to talk about what is I need to prepare for tomorrow, or have questions about that day. Sometimes just to keep that structure a little educationally relevant and to make sure that they're not having to look at the whole picture, but look at more of a shorter time frame of providing services. A monitoring system with the assignment responsibilities of implementation needs to be held and when the accommodations are provided. Let's go to the next page. And we're talking about the FBAs. And the FBA, which is called a functional behavior assessment, and this requires written consent before the district can conduct a functional behavior assessment, which I will probably interchangeably use FBA. The FBA is a method of gathering information regarding a child's behavior. So there would be like a series of days, like 14 days worth of data that is required, or may be required in a local district. And then they would go through and look at that data to see how they can clearly define what the behavior is and can be observed and recognized. You have a student, when there is a behavior, there's usually a behavior required that happened before that, antecedent that happened before that behavior, so that it can be picked up usually when you're doing that functional behavior assessment. You have to determine the seriousness of the behavior, and you provide information about when and where the behavior is occurring. It may be occurring only in the lunchroom. It may be only occurring when entering the school, exiting the school, or during certain different periods of educational. Then once you have the FBA completed, then you can work on a behavior intervention plan with the family, because you can have the family come in and you meet and discuss the FBA and then you develop a BIP. And I'm kind of like Tracy, I like to call it the BIP instead of behavior intervention plan, because I like to use as much positive interaction with families as possible. I want to know what those strengths are. And so after you get the behavior intervention plan, you're going to look at what the functional behavior assessment provided, and the ARC uses the information to put a plan in place to develop social skills and behaviors needed to be successful. You want to put strategies that are going to reduce things that will trigger the behavior, teaching appropriate behavior to replace inappropriate behavior, strategies to increase appropriate behavior, and strategies to decrease inappropriate behavior. For an example, I was working with a family, and every morning, this fourth grader was having a total meltdowns in his fourth grade homeroom, which is probably the most least invasive thing you could do during the day. So once the FBA was completed, it was determined that there was a sign in the hallway right beside the classroom that said, in case of emergency, take stairs. Come to determine what his concern was, how do I get the stairs out of the school? He was a literal thinker. So you've got to, so those things are things that can't, simple things like that we take for granted and knowing what they interpret it to mean. But this student thought he really had to get the stairs because it said, if the sign said, in case of emergency, take stairs. So he was concerned about that. So sometimes this is very, very helpful in developing and solving any kind of inappropriate to make more appropriate behaviors. All right, let's go to the next page where we talk about building focus on strengths. This is one of the things that I really strive on with working with students, is to give them the most encouragement of the positive things that they do, whether it's good visual memory, which most of the students have, ability to stick to routines, they're very attentive to details, strong rote memory skills, intense focus on tasks that are interested in. That's sometimes like with classroom instruction, and you've got a student that's totally not being involved, but it's not something that they're interested in. You can still do your curriculum and follow something that is of interest to the students and get all your required curriculum requirements in for that classroom setting. They can be affectionate and loving, and they only look at the world in a different way. Students with autism sometimes are not very favorable of sarcasm or jokes because they don't understand them. To give you an example, I worked with a student here at the university, and he was applying for an internship. And he went for the internship, and he had purchased a new suit for that interview. And when he went in for the interview, the company person said, "You look like a movie star." And he said, "I'm a U of L student." He did not process that he was getting a compliment. And he said to me, he said, "Why did he just say I look nice?" I said, "I agree with you." but there's outside factors that evolve that we have to work on, and to build that focus and work on the strengths of the student. All right, it's a partnership. Parents, schools, and other partners such as mental health providers all want what is best for the students. One of the things that I can suggest to families is please keep in contact with your community mental health centers. Those community mental health centers can help you in providing services that may not be in the school time frame. Like Tracy was talking about, may not have the length of speech that you feel that the student must have. Well, they can look at outside services to be able to provide services to the student. Community mental health centers can help you with getting on waivers. They can help you with getting a lot of different services that the school system really is not required to do. But it also will help the family to get those skills that they want for their child to have and make it at a much rapid pace. We must show respect for others. This includes communicating frequently, following the chain of command. And when you contact the school, it's simply best to reach out to the teacher first. Work together to be consistent and strategies being implemented. Evidence-based practices, we've been talking about the EPBs, and these are research-based methods that can help enhance educational learning. Augmentative communication device. Augmentative communication, they may start out in speech with a picture exchange program, which we call PECS. And with that program, it will help the individual to be able to advance then maybe to the augmentative communication device, which is a device that totally works with language. Sometimes I'll have families say to me, well, he'll get on the web on the device. Well, it looks like a laptop, but you can't get on the web. It's totally a language device. And this can increase language. You can also look at another one would be exercise and movement. Sometimes that helps. And I'll tell you another area is sometimes listening to music. A lot of my students that I've worked with, do require music. It helps to calm them. And so I just did a training last week. And one of the things that I asked families to do was, back of this card, I want you to write down what is something that your child responds to in a positive manner. And 50% of them mentioned music is a calming factor for their student. The parent implemented interventions can help. Peer-based instruction, prompting, reinforcing. So there's a list in our resource folder that gives you of all the evidence-based practices that you can go in and get more detail about each one of those. The big 5 evidence-based practices are your antecedent-based interventions, visual supports, communication, systematic instruction, and reinforcement. When I'm navigating resources for families, a lot of times the first thing the family will say to me is, we need behavior. Well, first of all, we have to find out, does the child have a communication system? Communication is the first thing that I like for families to because without communication, some type of communication system, you're probably going to have behaviors. And so we want to stem that. And so sometimes you'll have to say, well, my child does have communication. So I'll say, can the student follow a command, which usually is yes. Can the student request something from you? And a lot of the times they'll say, well, they point or they take my hand and take me to there. That's not a form of communication. It is they're communicating in that form, but it's not a communication form. So we want to work on communication before we look at getting a lot of the behavior strategies, because that you're still going to have behavior problems without that communication system. Systematic instruction is like students with autism like to have a system, that process that they can follow. Visual supports is a great thing. Just like in the morning, your student may want to independently dress themselves. You can do a visual support that the parent at home can say, these are the processes and steps you must do to be completely dressed to go to school. At school, there can be visual supports to tell you what are the routine for your routine for the day, and gives a child more time to implement those in a correct manner without any incidences. One of the best things as a teacher I could find is you go to Amazon and you can get one of those little light up timers. And when you, because like a lot of times in a classroom, a teacher can say, all right, we're going to do reading. Well, then they said when the time is up for reading, they will say,
you only go to school half a day. Finally got his diary straightened out.
pardon?
He's been having problems with his diaries. He wasn't
Can
getting
everybody please check and make sure they're muted, please? Sorry, Mike.
Okay. And so you want to make sure that communication, that systematic and visual supports. Visual supports is very helpful. With that, when you get, I was talking about the timer with the instruction, then what we want to do is the teacher will say, now we're going to do math. Well, you may have a meltdown with the student. So what we want to do is, if you have that timer and say, when this timer ends, then we will be doing math. The student usually can respond to that because they know what the beginning and the end of what the process is going to be. Because in their mind, we'll do math when we get to do the entirety of this book at reading. And then I've got the next page of strategies for collaborating with autistic students for success. And these are strategies that are very, very helpful. A syllabus to be able to like know what is required for me to be successful in this course or this class. Assignments, knowing what the assignments are when they're due. Sometimes students, even when there's an assignment and the teacher said in the syllabus will be on a certain date. Well, something has happened and then the teacher said, I've changed the date 2 weeks later. It gets very frustrating for the student because they have already like in their mind got that it's supposed to be on this Tuesday. So sometimes the least amount of changes you can make, and I know sometimes that's, you can't help that, but it really will help with working with the students. Mentor, counseling, lab assistance, especially in labs. There's sometimes a lot of meltdown issues that'll happen there in a lab because there's groups of people working together and a lot of groups in one room. So we want to work at those tweak those things out so you don't have those problems. We're mindful of the idioms, sarcasm, and jokes, voice, facial expression, body language, and gestures. One thing I also want to really enforce is be careful what you say in front of an individual with autism because they have autism, they're not deaf. And so sometimes that can be reversed for a lot of families. I know we've gone through this rather quickly. Our time is kind of coming to a close. And Tracy, I'm going to turn it back to you to talk about the resource folder and the evaluation.
Great. So we have put our website on here, kentuckyautism.org. There's tons of resources on there. I encourage you to sign up for our listserv, follow us on Facebook, Twitter, or I think it's called X now. I don't know. So just know that there's lots of things on there. Our YouTube channel, kind of like this video, will end up on there. So if you have missed any of our previous sessions, they are on there. I know our resource folder has been shared on the links, but it has a wealth of information that we hope will be helpful to you. Mike and I have both included our email here for you. So if you need to reach out to us with any questions, we are glad to help. And then I know the survey has also been shared in the chat box. So it is there. You can also scan the QR code there on the screen. And if you guys have any questions, I think we've got just a few minutes that we can do that.
Tracy and Mike, there was one that came up just now. Somebody had a question about related services for IEPs. Should they come off mute and ask that?
If it is not student specific to where we're going to be voiding any confidentiality, I'm okay with you asking now. If you feel like it's a little bit more student specific and rather email, that is fine. We'll watch our emails.
They said no PHI, no public health information, personal health information.
So my question is that the school districts provide related services as part of the IEP, but it's oftentimes not as frequent as would be ideal. Is there anything that would prevent students from getting additional related services outside of those provided in the IEP for the purposes of educational programming?
You're talking about like outside related services, like community speech services, for example?
Right, like so supplementing the speech and OT or PT services that they get through the IEP with private services external to it.
No, in fact, many of our students do that because again, the models are just so different that many students do that. And to be honest, even if they're on Medicaid, it comes out of different funding sources within Medicaid, so it doesn't affect what they're getting in school versus what they could get outside of school. So they can absolutely take benefit of both. And to be honest, if the parent's willing and the child is able to withstand the stamina of a full day like that, I highly encourage it.
And that would be excused under, like, I mean, so doctor appointments or, you know, like therapeutic service appointments would be excused absences. That wouldn't cause any issues with like tardiness and truancy or anything, right?
It should not affect anything with tardiness or truancy. The only thing I kind of caution, and this is just kind of professional to professional, is you've got to look at what are they missing when you take them out of school to go to that private outside therapy, regardless of what it is, you know, because we don't want to create any bigger holes or create a hole where there wasn't a hole. So we don't want a missing reading every, you know, 2 or 3 days a week and possibly creating a reading deficit later down the line because of that.
Okay. Thank you. I appreciate it.
No problem.
Thank you for the question. We've got about 5 more minutes. Does anybody else have anything? Okay, I'm gonna take the silence as a no. I want to thank Tracy and Mike for being here and their wonderful presentation today. Thank you all so much. They do wrap up our fall training series with KATC. I will say that I will be meeting with KATC here in the next month to go over making plans for our training series in 2024. We'll be doing it again in the spring and host another one in the fall. So I did drop the survey link in the chat. Please fill that out. We do take your all's comments about topics that you would like to get more information on to help formulate our plans for the following years for trainings. Those certificates are also sent out based on the fact that those surveys have been filled out and should be sent out earlier next week. If you all need additional information that you didn't receive today, please don't hesitate to reach out to me. My name is Andrea Polk. I put my email in the chat, but it's polka at aetna.com. So thank you all again for joining us. And please let me know again if you guys need anything. Tracy, Mike, thank you all so much.
Thank you.
Mike and Tracy, real quick, there was a question